Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, November 17th, giving you the update from Albany Med. All right, Fred, COVID is definitely a topic again.
It is, unfortunately.
Let's take a look at the graph here. This is the 8 counties of the capital region. I think the graph speaks for itself. There are currently 125 people admitted to hospitals in the 8 counties currently either being treated for COVID or currently still being diagnosed with COVID. Any comments on that, Fred?
Yeah, so Dennis, this is the highest we've been since early May as a region. So it's a pretty significant increase.
We did look at the demographics today based on the app that we have here in-house. At least at Albany Medical Center, it does still primarily seem to be affecting people who are 50 and above.
Right.
I didn't see anybody on that list who was under the age of 30. I'm not sure if I have that information.
No, so we've had a couple of college students,
right,
but in and out quickly, not terribly ill. But you're right, it's the same demographics. But interestingly enough, Dennis, they seem to be getting out of the hospital quicker, and as we've said before, fewer in the intensive care units.
Excellent. We'll get to those numbers in a second. Here's the graph at Albany Medical Center. These are admissions and discharges. Let's go back about 3 months. This graph gives a run of the last 3 months. You can actually see, Fred, in the last 7 days, we've had 22 in and 12 out. So we've picked up 10 in the last week. So let's get to that third graph here. This is our morning census here. We currently have 39 in the hospital.
That's right.
27 on the floor, 12 in the ICU, 2 that were on ventilators when I looked at the report this morning.
Right, and again, as I said before, fewer people in the ICU, fewer people vented than back in the spring. So difference there in how sick they are.
So looking at those numbers, as we mentioned last week, Fred has started up our incident command again, meeting twice a week. Those numbers might increase. The same leaders from around the medical center talking about issues related to COVID. There are going to be some messengers that are going to come out on a regular basis that's going to update our workforce on decisions that are made there. Let's talk about a couple things that were discussed today. Let's start with masking. 2 things within the area of masking. Fred, we heard today that despite the fact that our workforce is wearing masks everywhere, sometimes at the bedside that's not sufficient. There needs to be more done.
That's right, Dennis. So you can get infected by droplets, obviously being breathed in, but also your mucous membranes, so your eyes in particular. So in addition to a mask, when you're at the bedside, you have to have eye protection, goggles or a shield to prevent that exposure. And
we heard today in our safety brief, and correct me if I have this number wrong, that we have 55,000 face shields available.
That's right, Dennis.
We have more than adequate number for any member of our workforce who's at the bedside to wear goggles or face shield or some type of protection for those mucous membranes. So we want people to be wearing them.
Absolutely. And a group's getting together tomorrow to look at PPE education in general and start rolling that out again. So look for that to come your way.
Excellent. And then the other topic about masks is something that the medical center is doing, which is masking patients. What can you tell me about that?
So that was a decision that came out of Incident Command today. So obviously patients can expose staff, right? So if a patient's in a double room, we're going to ask them, if tolerated, to wear a mask so they don't expose either staff or their roommate. And if they're in a single room, we're going to ask them to put a mask on when staff comes in. Okay. So another layer of protection for our staff and ultimately for our patients.
Sounds like a prudent thing to do. It's the type of thing, we've mentioned that this process evolves, there's new thinking, there's new ways of doing things. If that's the recommendation from our epidemiology team, then that's what we're going to do.
So Dennis, clearly COVID is increasing in incidence in our community. The positive test rate doesn't seem to be going up. We're actually the second lowest region in the state, which is great, but we're doing a lot of testing. Mm-hmm. And I'm taking my cues from the growth in hospitalizations around these kinds of decisions.
Excellent, excellent. Let's talk about something else. So from March forward, members of our workforce, when they come in, have either gotten temperature checked and symptom screened to be sure that they're not working sick. And we've had an app that people could log into where they register whether or not they have symptoms. But as we've learned, the symptoms of COVID are often a little bit obtuse. They're not obvious. It's not fever and cough or shortness of breath. So Fred, the symptom checklist has been expanded to align with other types of, I say, non-specific symptoms that can be associated with COVID.
That's right, Dennis. So muscle aches, fatigue, nausea, vomiting, diarrhea, and probably importantly, new loss of taste or smell are all things that we're going to start asking now in that log. And so if you're experiencing any of those symptoms, you'll report that to your manager, and your manager will send you to employee health to be tested.
So this is incredibly important. We have a very professional workforce, and we expect them to be honest, and we expect them to admit to these symptoms. And if they come forward and have one of these symptoms, then the commitment is we'll test them quickly and make sure that they do or don't have COVID, and these symptoms are important to call out. It's
That's
similar
right.
to what they're doing in the schools as well.
That's right.
All
Absolutely.
right, very good. And we think we're going to see that on the app in short order.
That's right. And even on the paper logs
And
as
paper
well,
logs
because
as
some
well.
people are using paper logs.
Good news.
Yeah.
Vaccine.
Yes.
We heard in the news yesterday that there's a second major pharmaceutical company which has some very good results when it comes to their COVID-19 vaccine trials, Moderna.
That's right, Moderna. So they actually reported yesterday about 95% efficacy in their vaccine. And the way that breaks down is in the 30,000 patients that are in their trial, half getting a placebo, half getting the active vaccine, there were 95 infections. 90 of them were in the placebo, only 5 were in the treatment group.
Incredible.
So that's pretty good. That's a pretty good result.
And so now we have 2 major pharmaceutical companies that may be able to mass produce this either late this year or early next year. So that's great news. And we know there are others that are close as well.
That's right. And there's another aspect to the Moderna product that's very
Yes.
important as well.
Yeah, it's the storage, right?
That's
in
right.
other words, the way in which the vaccine is going to be stored may allow for it to be distributed more widely, and it doesn't require temperatures as low as 90 degrees below zero.
For 30 days, you can actually store it in the refrigerator, which actually is going to be very helpful.
I know one of the things that people were concerned about distribution is not just major metropolitan areas, but also out into places that are less densely populated and how you get it out there. So this will help.
Absolutely.
Yeah. And then I've also seen the published list of how they're going to prioritize who gets the vaccine. Certainly, healthcare workers and the vulnerable population are always still at the very top list. So once this vaccine's available, our team that's working on this is going to put out for us a plan on how we're going to get our workforce
That's right.
vaccinated.
Yep.
All right, wonderful. I think with the frequency of the reports, we're back again on Thursday.
That's right.
And obviously, we'll have a lot to talk about there with COVID as well, and any updates from Incident Command.
There's one more thing, Dennis, that
Yes.
maybe we should mention. We're moving into the holiday season.
Yes.
And I know that staff really likes to celebrate with their partners, their colleagues. And that might involve bringing in food, potluck lunches or dinners, those kinds of things. Those are episodes where people can get infected from each other. And so as much as it pains me to say this, because I'm Italian and food is important in my life, we really need to prohibit that this year. So please be aware that we're not going to want you to celebrate holidays here in the hospital with food.
Okay, and I think that was a recommendation which came out of Incident Command today.
That's right. That came out of Incident Command today as well.
All right, very good. All right, thank you very much. We'll be back again on Thursday. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.